Chapter 17, Hygiene, in MedSurg, Timby. Hygiene. Hygiene means those practices that help in promoting health through personal cleanliness. People foster hygiene through activities such as bathing, performing oral care, cleaning and maintaining fingernails and toenails, and shampooing and grooming hair. Hygiene also includes care and maintenance of devices such as eyeglasses and hearing aids to ensure continued and proper function. Hygiene practices and needs differ according to age, inherited characteristics of the skin and hair, cultural values, and state of health. This chapter provides suggestions for carrying out hygiene practices when providing client care. The integumentary system. The word integument, covering, refers to the collective structures that cover the surface of the body and its openings. Most hygiene practices are based on maintaining or restoring a healthy integumentary system, which includes the skin, mucous membranes, hair, and nails. Because the mouth, or oral cavity, which is lined with mucous membranes, contains teeth, this chapter also discusses the accessory structure. Skin. The skin consists of the epidermis, The skin consists of the epidermis, dermis, and subcutaneous layer. The epidermis, or outermost layer, contains dead skin cells that form a tough protein called keratin. Keratin protects the layers and structures within the lower portions of the skin. The cells in the epidermis are shed continuously and replaced by the dermis, or true skin, which contains most of the secretory glands. The subcutaneous layer separates the skin from skeletal muscles. It contains fat cells, blood vessels, nerves, and the roots of hair follicles and glands. Skin structures carry out the following functions: protect inner body structures from injury and infection, regulate body temperature, maintain fluid and chemical balance, provide sensory information such as pain, temperature, touch, and pressure, and assist in converting precursors to vitamin D when exposed to sunlight. This diagram shows a cross-section of the skin. You have the epidermis, the dermis, and the subcutaneous tissue, the sebaceous glands, the hair follicles, the papilla, sweat pores, stratum corneum, erector pili muscle, eccrine, ECCRINE, sweat glands, nerves, and arterioles and venules. It also shows pressure receptors and adipose fat cells. Mucous membranes are continuous with the skin. They line body passages such as the digestive, respiratory, urinary, and reproductive tracts. Mucous membranes also line the conjunctiva of the eye. Goblet cells and the mucous membranes secrete mucus, a slimy substance that keeps the membranes soft and moist. Hair. Each hair is a thread of keratin, a protein substance. Hair is formed from the cells at the base of a single follicle. Although hair covers the entire body, its amount, distribution, color, and texture vary considerably according to location and among males and females, infants and adults, and ethnic groups. In addition to contributing to a person's unique appearance, hair basically helps prevent heat loss. As heat escapes from the skin, it gets trapped in the air between the hairs. The contraction of small erector, ARRECTOR, pili, PILI muscles around hair follicles, commonly described as goosebumps, further generates body heat. Sebaceous glands in the hair follicles release sebum, an oily secretion that adds weight to the shafts of hair, causing them to flatten against the skull. Oily hair further attracts dust and debris. The texture, elasticity, and porosity of hair are inherited characteristics influenced by the amount of keratin and sebum produced. To alter the basic genetically inherited structure, some people use chemicals to curl, relax, or lubricate their hair. Nails. Fingernails and toenails are also made of keratin, which in concentrated amounts give them their tough texture. Fingernails and toenails provide some protection to the digits. Normal nails are thin, pink, and smooth. The free margin ordinarily extends from the end of each finger or toe, and the skin around the nails is intact. Changes in the shape, color, texture, thickness, and integrity of the nails provide evidence of local injury or infection, and even systemic diseases. There's a free edge where the white part of the nail on the outer edge is. The nail plate is the pink overall nail. The lunula, Lunula, is a moon-shaped look to the base of the fingernail. And also you have the cuticle, which lines the base of the fingernail. And those are all external nail structures. The external and cross-sectional views of a nail are shown on page 356, and internal and external nail structures are also shown on page 356 in TIMBY. Teeth. Teeth, the enamel of which is a keratin structure, are present beneath the gums at birth. The exposed portion of each tooth is referred to as the crown. The portion within the gum is the root. The teeth begin to erupt at about 6 months of age and continue to do so for 2 to 2.5 more years. As the jaw grows, the deciduous teeth, or baby teeth, are replaced by permanent teeth. Adults have 28 to 32 permanent teeth, depending on whether the third molars, called wisdom teeth, are present. Healthy teeth are firmly fixed within the gums. Their alignment, which is related to jaw structure, generally is a result of heredity. Although the teeth are white originally, they become discolored from chronic consumption of coffee or tea, tobacco use, or certain drugs such as tetracycline antibiotics taken during childhood. The integrity of the teeth largely depends on the person's oral hygiene practices, diet, and general health. Saliva, which moistens food and begins the digestive processes, tends to keep the teeth clean and inhibits bacterial growth. The accumulation of food debris, especially sugar and plaque, PLAQUE, a substance composed of mucin, MUCIN, and other gritty substances in saliva, support the growth of mouth bacteria. The combination of sugar, plaque, and bacteria may eventually erode the tooth enamel, causing caries, CARIES, which is a cavity. Common dental problems. Again, sugar, plaque, which is a substance composed of mucin and other gritty substances in saliva, support the growth of mouth bacteria. The combination of sugar, plaque, and bacteria may eventually erode the tooth enamel, causing caries, which is called cavities. Tartar, which is hardened plaque, is more difficult to remove and may lead to gingivitis, which is inflammation of the gums. Pockets of gum inflammation promote periodontal disease, a condition that results in the destruction of the tooth-supporting structures and bones that make up the jaw. Nutrition notes. Although sugars are widely known to contribute to dental caries, starches are also to blame. Mouth bacteria ferment both of these types of carbohydrates to an acid that erodes teeth enamel. So although whole grain crackers are more nutritious than soft drinks, their potential damage to teeth is the same. How often carbohydrates are consumed, what they are eaten with, and how long after eating brushing occurs may be more important than whether or not they are sweet or sticky. Gerontological considerations. Tooth loss is common in older adults as a result of conditions such as periodontal disease, poor dental care, and chronic illnesses. Hygiene practices. The integument, or skin, contains many secretory glands that produce odors and attract debris, and the teeth are prone to decay if uncared for. Therefore, hygiene measures are beneficial for maintaining personal cleanliness and healthy integumentary structures. Although hygiene practices vary widely, most Americans routinely perform bathing, shaving, brushing teeth, shampooing, and caring for nails. Gerontological considerations. Poor hygiene and grooming in older adults can be indicators of conditions such as visual impairment, functional limitations, dementia, depression, abuse, or neglect. Bathing. Bathing is a hygiene practice in which a person uses a cleansing agent such as a soap and water to remove sweat, oil, dirt, and microorganisms from the skin. Although restoring cleanliness is the primary objective, bathing has several other benefits: eliminating body odor, reducing the potential for infection, stimulating circulation, providing a refreshed and relaxed feeling, and improving self-image. In addition to bathing for hygiene purposes, other types of bathing serve different functions. In general, however, most bathing is done in a tub or shower, at a sink, or at the bedside. Bathing is a hygiene practice in which a person uses a cleansing agent such as soap and water to remove sweat, oil, dirt, and microorganisms from the skin. Although restoring cleanliness is the primary objective, bathing has several other benefits: eliminating body odor, reducing the potential for infection, stimulating circulation, providing a refreshed and relaxed feeling, and improving self-image. In addition to bathing for hygiene purposes, other types of bathing serve different functions. In general, however, most bathing is done in a tub or shower, at a sink, or at the bedside. Tub bath or shower. If the safety risks are negligible and there are no contraindications, the nurse encourages clients to bathe independently in a tub or shower. Most hospitals and nursing homes equip bathing facilities with various rails and handles to promote client safety. Gerontologic considerations. To reduce the risk of falls in older adults when bathing, there are a variety of safety measures that can be provided. Non-skid strips on the floor of tubs and showers are helpful. Grab bars should be placed at arm level and within reach. A tub or shower seat is an important safety measure for adults who have mobility limitations or difficulty maintaining balance. Diminished ability to sense temperature changes may occur. The temperature of bath water should be checked with the wrist before immersing older adults. Long-handled bath sponges or handheld shower attachments help older adults with limited range of motion maintain independence. Older adults should use soap sparingly because it is extremely drying to the skin. A mild, superfatted, non-perfumed soap such as Castle, Dove, Tone, or Basis may be preferable. Because older adults have thin skin, decreased skin elasticity, and increased fragility of blood vessels in the dermis, gentle patting motions rather than harsh rubbing motions should be used when drying the client's skin. One should thoroughly inspect the feet of older adults for ulcerations or other lesions of which they are unaware, especially diabetics and anyone with impaired circulation in the peripheral area. Sitz baths are immersion of the buttocks and perineum in a small basin of continuously circulating water. The purpose is to remove blood, serum, stool, or urine, and it also reduces local swelling and relieves discomfort. Sponge bath, applications of tepid water to the skin, reduces a fever. Medicated bath is soaking or immersing in a mixture of water and another substance such as baking soda or oatmeal or cornstarch. This relieves itching or a rash. A whirlpool bath is warm water that is continuously agitated within a tub or tank. This improves circulation, increases joint mobility, relieves discomfort, and removes dead tissue. A partial bath, a daily bath or shower, is not always necessary. In fact, for older adults who perspire less than younger adults and are prone to dry skin, frequent washing with soap further depletes oil from the skin. A partial or less frequent bathing sometimes is appropriate. A partial bath means washing only those body areas that are subject to greater soiling or that are the sources of body odor, generally the face, hands, axilla, and perineal area. Partial bathing is done at a sink or with a basin at the bedside. Sometimes the perineum, the area around the genitals and rectum, requires special or frequent cleansing in addition to bathing. Perineal care, pericare, techniques that are used to cleanse the perineum, is especially important after a vaginal delivery or gynecologic or rectal surgery, so that the impaired skin remains as clean as possible. It is also appropriate whenever male or female clients have bloody drainage, urine, or stool collected in this area. When providing perineal care, the nurse must prevent direct contact between themselves and any secretions or excretions. This is generally accomplished by wearing clean gloves. Cleanse so that secretions and excretions are removed from less soiled to more soiled areas. These principles help prevent the transfer of infectious microorganisms to the nurse and to uncontaminated areas on or within the client. Bed bath. Clients who cannot take a tub bath or cannot shower independently may be given any one of three types of baths: a bed bath, a towel bath, or a bag bath. During a bed bath, washing with a basin of water at the bedside, the client may actively assist with some aspects of bathing. Bath oils can be added to the water basin when administering a bed bath to an older client. Oils are not used in showers or bathtubs because they increase the risk of falls. Avoid the use of skincare products containing alcohol or perfumes when caring for older adults because these products tend to aggravate dry skin conditions and cause allergic reactions. Increasing oral fluid intake or adding humidity to the air reduces the discomfort of dry skin experienced by older adults. Bed bath continues. Some agencies use two variations: the traditional bed bath, the towel bath, and the bag bath because they save time and expense. Advantages of commercial bag baths. It reduces the potential for skin impairment because the non-rinsable cleanser lubricates rather than dries the skin, prevents the transmission of microorganisms that may be growing in wash basins, reduces the spread of microorganisms from one part of the body to another because separate cloths or regions of the towel are used, preserve the integrity of the skin because friction is not used while drying the skin, promote self-care among clients who may lack the strength or dexterity to wet, wring, and lather a washcloth, save time compared to conventional bathing, promote comfort because the moist towel or cloths are used so quickly and they are warmer when applied. Towel bath. With the towel bath, the nurse uses a single large towel to cover and wash a client. It requires a towel or bath sheet measuring 3 by 7 feet, but no basin or soap. The nurse pre-folds and moistens the towel or bath sheet with approximately 1/2 gallon of water heated to 105 to 110 degrees Fahrenheit of no-rinse liquid cleanser and 1 ounce of no-rinse liquid cleanser. He or she unfolds the towel so that it covers the client and uses a separate section to wipe each part of the body, beginning at the feet and moving upward. The nurse folds the soiled area of the towel to inside as he or she bathes each area and allows the skin to air dry for 2 to 3 seconds. After washing the front side of the body, the nurse positions the client on the side and repeats the procedure. He or she unfolds the towel so that the clean surface covers the client. The nurse bathes the client's back and then the buttocks. When the towel bath is complete, the nurse changes the bed linens. Bag bath. A bag bath involves the use of a commercially packaged kit with 8 to 10 pre-moistened disposable cloths in a plastic bag or container. The cloths contain a no-rinse surfactant, a substance that reduces surface tension between the skin and surface contaminants, and an emollient humectant, a substance that attracts and traps moisture in the skin, but no soap. The nurse warms the container and its contents in a microwave or warming unit, or sets them in a container of warm water before use. At the bedside, the nurse uses separate cloths to wash each part of the client's body. Rinsing is not required. Air drying circumvents the need for a towel. Is the following statement true or false? Partial bathing is most common in young adults. The answer is false. Partial bathing is most common in older adults. As you know, older adults have drier skin and need less soap and do not need to do a full bath. Is the following statement true or false? Towel baths are very expensive. The answer is false. Towel baths save expense. It cuts down on laundry soap and products, and towels, the expense of purchasing towels, and the soap. Shaving. Shaving removes unwanted body hair. The nurse respects personal or cultural differences and asks each client about his or her preferences before assuming otherwise. Shaving is accomplished with an electric or a safety razor. In some circumstances, use of a safety razor is contraindicated, such as someone on anticoagulants, which are drugs that interfere with clotting, people receiving thrombolytic agents, drugs that dissolve blood clots, taking high doses of aspirin, blood disorders such as hemophilia, liver disease patients who have impaired clotting, people with rashes or elevated or inflamed skin lesions on or near the face, or who are suicidal. Shaving is accomplished with an electric or a safety razor. In some circumstances, as above, the use of a safety razor is contraindicated, and an electric or battery-operated razor is used. When the client cannot shave, the nurse assumes responsibility for this hygiene practice. On page 351, box 17-1, there are explicit directions for how to shave your patient's face. Oral hygiene. Oral hygiene consists of those practices used to clean the mouth, especially brushing and flossing the teeth. Dentures and bridges also require special cleaning and care. Toothbrushing and flossing. Clients who are alert and physically capable generally attend to their own oral hygiene. For clients confined to a bed, the nurse assembles the necessary items: a toothbrush, toothpaste, a glass of water, an emesis basin, and floss. Most dentists recommend using a soft-bristled or electric toothbrush and toothpaste twice a day. For the advantages of electric toothbrushes, see box 17-3. Flossing removes plaque and food debris from the surfaces of teeth that a manual or electric toothbrush may miss. The choice of unwaxed or waxed floss is personal. Waxed floss is thicker and more difficult to insert between teeth. Unwaxed floss frays more easily. Although conscientious oral hygiene does not prevent dental problems completely, it reduces the incidence of tooth and gum disease. Therefore, clients need to learn how to maintain the structure and integrity of their natural teeth. Oral care for unconscious clients. Oral care cannot be neglected because the client is unconscious. In fact, because unconscious clients are not salivating in response to seeing, smelling, and eating food, they need oral care even more frequently than conscious clients. Sordes, S-O-R-D-E-S, are dried crusts containing mucus, microorganisms, and epithelial cells shed from the mucous membrane, are common on the lips and teeth of unconscious clients. Toothbrushing is the preferred technique for providing oral hygiene to unconscious clients. Clients who are not alert, however, are at risk for aspirating, which is inhaling saliva and liquid oral hygiene products into their lungs. Aspirating liquids predispose clients to pneumonia. Therefore, the nurse uses special precautions to avoid getting fluid in the client's airway. In addition to toothbrushing, the nurse moistens and refreshes the client's mouth with oral swabs. He or she uses various substances for oral hygiene, depending on the circumstances and assessment findings for each client. Anticoagulant therapy, even daily low-dose aspirin, increases the risk of bleeding. Again, be careful with toothbrushes as well with people that are on anticoagulants. Denture care. Dentures, artificial teeth, substitute for a person's lower or upper set of teeth or both. A bridge, a dental appliance that replaces one or several teeth, is fixed permanently to other natural teeth so that it cannot be removed, or it is fastened with a clasp that allows it to be detached from the mouth. For clients who cannot remove their own dentures, the nurse puts on gloves and uses a dry gauze or clean face cloth to grasp and free the denture from the mouth. He or she cleans dentures and removable bridges with a toothbrush, denture, cleanser, or toothpaste and cold or tepid water. The nurse takes care to hold dentures over a plastic basin or towel so that they will not break if dropped. If you're cleaning dentures in a patient's sink, you must put a towel down before you clean the dentures so that if you drop them, the dentures do not break. Dentists recommend that dentures and bridges remain in place except during cleaning. Keeping dentures and bridges out for long periods permits the gum lines to change, affecting the fit. If a nurse removes a client's bridge or dentures during the night, he or she stores them in a covered cup. Plain water is used most often to cover dentures when they are not in the mouth, but some add mouthwash or a denture cleanser to the water. Question: is the following statement true or false? Dentures are best washed with hot water. You should answer false. Dentures are best washed with cold or tepid water. Tepid is lukewarm. Hair care. Sometimes clients need assistance with grooming or shampooing their hair. The following are recommendations for grooming a client's hair. Hair grooming. Try to use a hairstyle the client prefers. Brush the hair slowly and carefully to avoid damaging the hair. Brush the hair to increase circulation and distribution of sebum. Use a wide tooth comb starting at the ends of the hair rather than from the crown downward if the hair is matted or tangled. Apply a conditioner to loosen tangles. Use oil on the hair if it is dry. Many preparations are available, but pure castor oil, olive oil, and mineral oil are satisfactory. Braid the hair to help prevent tangles. If hair loss occurs from cancer therapy or some other disease or medical treatment, provide the client with a turban or baseball cap. Avoid using hairpins or clips that may injure the scalp. Obtain the client's or family's permission before cutting the hair if it is hopelessly tangled and cutting seems to be the only solution to provide adequate grooming. And always ask before you touch someone's head or hair. Shampooing. Hair should be washed as often as necessary to keep it clean. A weekly shampoo is sufficient for most people, but shampooing more or less often will not damage the hair. Long-term healthcare facilities often employ beauticians and barbers, but if professional services are unavailable, the nurse or delegated nursing staff member shampoos the client's hair. Dry shampoos, which are applied to the hair as a powder, aerosol spray, or foam, are available for occasional use. The nurse applies the cleaning agent to the hair, massages it thoroughly to distribute, and brushes or towels it from the hair afterward. Nail care. Nail care involves keeping the fingernails and toenails clean and trimmed. Clients who have diabetes, impaired circulation, or thick nails are at risk for vascular complications secondary to trauma. The services of a podiatrist, a person with special training in caring for feet, are often indicated. It is best to check with the client's physician before cutting fingernails or toenails. If there are no contraindications, the nurse cares for the client's nails as follows. Soak the hands or feet in warm water to soften the keratin and loosen trapped debris. Clean under the nails with a wooden orange stick or other sturdy but blunt instrument. Push cuticles, the thin edge of skin at the base of the nail, downward with a soft towel. Use a handheld electric rotary file made by Dremel or some other company, or an emery board to reduce the length of long fingernails or toenails. Avoid sharp or jagged points that may injure the adjacent skin. To keep the skin and nails soft and supple, the nurse applies lotion or an emollient cream after bathing and nail care. If foot perspiration is a problem, he or she uses a prescribed antifungal deodorant powder. Because impaired skin, especially on the feet, is often slow to heal and is susceptible to infection, the nurse immediately reports any abnormal assessment findings. To avoid injuring the feet, clients should wear sturdy slippers or clean socks with non-skid soles and supportive shoes. Gerontological considerations. Encourage older adults to purchase sturdy shoes and to replace or repair them as they become worn to prevent skin and nail impairment in the lower extremities. Question: is the following statement true or false? Applying alcohol to tangled hair helps remove the tangles. Answer: true. Applying alcohol to tangled hair removes the tangles, but this is not true according to cosmetologists. According to cosmetologists, the hair is severely dried by the use of alcohol. Visual and hearing devices. Encourage older adults to purchase visual and hearing devices. Eyeglasses and hearing aids improve communication and socialization. Both represent a considerable financial investment. If they become damaged or broken, the temporary loss deprives clients of full sensory perception. Therefore, they should be well maintained and safely stored when not in use. Although eyeglasses and hearing aids are not body structures, they are worn in close contact with the body for long periods. Consequently, they tend to collect secretions, dirt, and debris that may interfere with their function and use. Therefore, the nurse cares for these devices at the same time that he or she provides other hygiene measures. Eyeglasses. Prescription lenses are made of glass or plastic. Plastic lenses weigh much less but are more easily scratched. Glass lenses are more likely to break if dropped. When not in use, eyeglasses are stored in a soft case or rested on the frame. The nurse cleans glass and plastic lenses as follows. Hold the eyeglasses by the nose or ear braces. Run tepid water over both sides of the lenses. Hot water damages plastic lenses. Wash the lenses with soap or detergent. Rinse with running tap water. Dry with a clean soft cloth such as a handkerchief. Do not use paper tissues because some contain wood fibers and pulp can scratch the lenses. Some prefer to use a commercial glass cleaner, but this is not necessary. Contact lens. Regardless of the type of contact lenses worn, proper care and cleaning are critical to preventing eye infections and trauma. A contact lens is a small plastic disc placed directly on the cornea. Clients usually wear contact lenses in both eyes, but some clients who have had cataract surgery on one eye wear a single contact lens or a single contact lens and eyeglasses. The nurse should not assume that someone who wears eyeglasses does not use a contact lens and vice versa. Several types of contact lenses are available: hard, soft, or gas permeable. All contact lenses, even disposable types, need removal for cleaning, eye rest, and disinfection. People who are not conscientious about following a routine for contact lens care risk infection, eye abrasion, and permanent damage to the cornea. When caring for a client who wears contact lenses, the nurse asks the client to remove and insert the lenses and to care for them according to his or her established routine. For clients who cannot do so, the nurse may assist with the removal of the lenses or should consult the client's ophthalmologist, a medical doctor who treats eye disorders, or optometrist, a person who prescribes corrective lenses, about alternatives to promote adequate vision and safety. Some people, when ill, resume wearing eyeglasses temporarily use a magnifying glass, or do without any visual aid. Contact lens removal. Before removing contact lenses, the nurse obtains an appropriate storage container. Commercial containers are available. Because the lens prescription may differ for each eye, the nurse labels the container left and right. The nurse elevates the client's head and places a towel over the chest to prevent loss or damage to the contact lens. The technique for removing soft contact lenses is different than for hard contact lenses. Soft lenses. To remove a soft contact lens, the nurse moves the lens from the cornea to the sclera by sliding it into position with a clean, gloved finger as the client looks upward. The nurse then gently grasps the repositioned loosened lens between the thumb and forefinger for removal. Soft lenses dry and crystallize if exposed to air, so the nurse immediately places them in a soaking solution in the storage container. Hard lens. To remove a hard contact lens, the blink method is the most common technique. The nurse positions and prepares the client similarly as for removing soft contact lenses, leaving the lens in place on the cornea. He or she places the thumb and a finger on the center of the upper and lower lids. The nurse applies slight opposing pressure to the lids while instructing the client to blink, which separates the hard lens from the cornea. If the blink method is unsuccessful, the nurse places an ophthalmic suction cup on the lens and with gentle suction lifts the lens from the eye. After removal, the nurse soaks the lenses in the storage container. Prosthetic eyes. A prosthetic eye is a plastic shell that acts as a cosmetic replacement for the natural eye. There is no way to restore vision once the natural eye is removed. The prosthetic eye and the socket into which it is placed needs occasional cleaning. If the client cannot care for the prosthetic eye, the nurse removes it by depressing the lower eyelid until the lid margin is wide enough to allow the prosthetic shell to slide free. The nurse irrigates the eye socket with water or saline before reinserting the prosthetic eye. Hearing aids. There are 4 types of hearing aids. In-the-ear devices are small, self-contained aids that fit in the outer ear. Question: is the following statement true or false? Infrared listening devices, IRLDs, are used by clients with hearing impairment to hear sounds outdoors. True or false? The answer is false. IRLDs cannot be used outdoors or in rooms that contain many windows or in well-lit rooms. Next, on page 361 in TIMBY, we are going to describe how to shave clients. Prepare a warm water basin, soap, a face cloth, and a towel. These supplies are necessary for wetting, rinsing, and lathering the face or other area that requires shaving. Wash the skin with warm, soapy water. Washing removes oil, which helps raise hair shafts. Lather the skin with soap or shaving cream. Use of soap or shaving cream reduces surface tension as the razor is pulled across the skin. Start at the upper areas of the face and work down. This progression provides more control of the razor. Begin shaving upper areas of facial growth. Pull the skin taut below the area to be shaved. This evens the level of the skin. Pull the razor in the direction of hair growth. Shaving with the hair reduces the potential for irritation. Use short strokes. They provide more control of the razor. Rinse the razor after each stroke or as hair accumulates. Rinsing keeps the cutting edge of the razor clean. Rinse the remaining soap or shaving cream from the skin. Rinsing reduces the potential for drying the skin. Apply direct pressure to areas that bleed, or apply alum sulfate, which is called a styptic pencil, at the site of bleeding. Pressure or alum helps to promote clotting. Apply aftershave lotion, cologne, or cream to the shaved area if the client desires. The alcohol in lotion and cologne reduces and retards microbial growth in the tiny abrasions caused by the razor, and cream restores oil to the skin. Client and family teaching, reducing dental disease and injuries. The nurse teaches the client or family as follows. Brush and floss the teeth as soon as possible after each meal, using the following techniques. Moisten the toothbrush and apply toothpaste. Hold a manual toothbrush at a 45-degree angle to the teeth, holding the toothbrush at a 45-degree angle to the gum. Brush the front and back of all teeth from gum line toward crown using circular motions, brushing from gum to crown of each tooth. Brush back and forth over the chewing surfaces of the molars. Brush the tongue very gently. Rinse the mouth periodically to flush loosened debris. Have the client deposit the rinse solution with an emesis basin. Wrap an 18-inch length of floss around the middle fingers of each hand. Slide the floss between the two teeth until it is next to the gum. Move the floss back and forth. Repeat flossing with new sections of the floss until all the teeth have been flossed, including the outer surface of the last molar. Use a tartar control toothpaste or a rinse containing fluoride. If brushing is impossible, rinse the mouth with water after eating. Use a battery-operated oral irrigating device which uses pulsating jets of water to flush debris from teeth, bridges, or braces. Eat fewer sweets such as soft drinks containing sugar, candy, gum that contains fructose, or any other form of sugar, pastries, and sweet desserts. Eat more raw fruits and vegetables that naturally remove plaque and other food as they are chewed. Eat 2 or 3 servings of dairy products per day to provide calcium. If antacids are used, select ones with calcium. Use frozen orange juice concentrate fortified with calcium. Do not use the teeth to open packages or containers. Use scissors rather than the teeth to cut thread. Do not chew ice cubes or crushed ice. Avoid chewing unpopped or partially popped kernels of popcorn. Have dental checkups at least every 6 months. Optional substances for oral care. Antiseptic mouthwash diluted with water reduces bacterial growth in the mouth and freshens breath. Equal parts of baking soda and table salt in warm water or baking soda mixed with normal saline removes accumulated secretions. 1 part of hydrogen peroxide to 10 parts of water releases oxygen and loosens dry, sticky particles. Prolonged use may damage tooth enamel. Milk of magnesia reduces oral acidity, dissolves plaque, increases flow of saliva, and soothes oral lesions. That was milk of magnesia. Lemon and glycerin swabs increases salivation and refreshes the mouth. Glycerin may absorb water from the lips and cause them to become dry and cracked if used more than a few days. Petroleum jelly lubricates lips. Make sure the patient's not on oxygen if you're going to use petroleum jelly. This is the end of the slideshow.